Tuberculosis is one of the oldest and most enduring infectious diseases known to humanity. Despite significant progress in medical science, this bacterial infection continues to have a heavy toll on global health, particularly in regions with limited resources and higher numbers of vulnerable populations. Tuberculosis can affect any organ in our body, but most commonly affects the lungs. The bacteria also have the ability to persist in the human body without causing symptoms, a condition known as tuberculosis infection. It has been estimated that 1/4 of the world's population has tuberculosis infection. Some of these people may never get sick. Others will develop symptoms months or years after being infected with tuberculosis. There is tuberculosis preventive treatment available, which kills the bacteria before a person has symptoms, thus preventing the progression to tuberculosis disease. However, one of the challenges to eliminate tuberculosis is identifying and treating all those who are infected without symptoms. Once a person gets sick, there are medicines available to treat and cure tuberculosis. Currently, treating tuberculosis requires a combination of antibiotics taken for an extended period, typically 4 to 6 months. Due to the duration of treatment and some of the restrictions that comes with it, some people face a challenge to complete the treatment. Therefore, it is important to provide them with social, psychological, and material support. Another challenge relates to antimicrobial resistance. Sometimes, the bacteria that causes tuberculosis can become resistant to the medicines we use to treat it. This means that the usual drugs might not be efficient, and doctors need to prescribe stronger and more expensive drugs for a longer time to treat the disease. Ending tuberculosis requires a comprehensive approach that addresses these challenges through strategies such as improved diagnostics, expanded access to treatment, addressing social determinants of health, and strengthening healthcare systems. Additionally, research into new tuberculosis vaccines and treatments developments are essential for the long-term control and eventual elimination of the disease.